walking. Now, brisk walking, you'd feel your heart rate coming up a little bit. You probably would break a sweat. Depending upon the time of year in Canada that you're doing this, you should feel it. What you would get when you're cycling, or if you're raking leaves, so a little heavier yard work, or swimming, breaststroke, that sort of thing. Dancing, if you get to do dancing, that's always fun. So that sort of effort, we need 30 to 60 minutes, and it's 4 to 7 days per week we would need to do that. Now, if you do the workout kind of stuff, so the stuff where maybe you're going to a facility to do that, or maybe you like to run in your neighborhood. The stuff that really gets your heart rate going, or definitely gets you sweating, you need 20 to 30 minutes, 3 to 4 times per week. Now, you can do a combination of this stuff. The other thing is you can accumulate it in 10-minute bouts. It doesn't have to be all at once. I know some people will think, oh my gosh, where am I going to find 60 minutes, or where am I going to find 30 minutes, because we're all busy. You can accumulate it in 10 minutes, and that's one of the neat things that you can actually use in your counseling, is sharing with the people that you work with, that you can get 10 minutes here or there. If you park a little further away from work, or you park in the far end of the shopping mall's parking lot, you might very well get in 10 minutes of moderate effort walking before you actually go shopping. So and then 10 minutes when you leave. So there's 20 minutes. Not really hard to do that. At the bottom, you'll notice that there's a little point that says endurance, flexibility, and strength. This table really talks about the stuff for your heart. It talks about the cardiorespiratory physical activities you need, and that's mostly what's been researched in terms of what we need for health. Strength has also been looked at. We know that we need to maintain our strength, and you will maintain your muscular endurance and some of your strength through these activities. We also may need to spend some time focusing on strength training, depending upon what you normally do. Also some stretching, so to improve flexibility, and we really need to work on our flexibility every day. So those are also highlighted in Canada's physical activity guides, and there are excellent suggestions as to what you can do. So what do we know about Nova Scotians' inactivity levels? How many are not getting enough physical activity? So this is really looking at not who's active enough, but the other way, who's not getting enough activity, so who's inactive. If you look at this graph here, you'll see Canada's rates. You'll see there's a difference between males and females. Across the age band, boys, males tend to be a little more physically active than females. So that's what you're seeing here as well. In Canada's overall rates, you'll see that 44% of males aren't getting enough physical activity, and more than 50% of females aren't physically active enough to obtain health benefits. So we have our work cut out for us. And those numbers are exacerbated just a little bit, or a little higher when you look at Nova Scotia. And you can actually look here at your own particular regions and see where your region actually fits, to see, if you need to have a little more efforts or not. But consistently, we're not physically active enough. Although we're not focusing on children, it's rather nice that I have the opportunity to actually speak about the grade 3, 7s, and 11s in our province, because that's a research project I've been involved with. The inactivity problem starts really in early adolescence. What this chart shows you is the percentage of students in grade 3, 7s, 11s broken up into boys and girls who obtain the recommended level of physical activity. So what we use for children is they need to obtain at least 60 minutes of moderate or more intense physical activity on 5 or more days of the week. And for our study, that had to include a weekend day. Well, what you'll see here, the grade 3 boys and girls, both in the 2001 and the 2005 PACE projects, more than 90% are meeting this objective. Not a surprise. Children play. Grade 3 students still play, and they play a fair amount outside. If you look at the grade 7s, and there's 2 things I'd like you to focus on. One is the drop from grade 3 to grade 7. It's a huge decrease. But the other thing I'd like you to focus on is the second set of PACE data, the 2005, how many fewer grade 7 students in the second, or the 2005, the second PACE evaluation that actually met these objectives. That's only about 45% of the grade 7s, and it's 26% grade 7 boys and 26% of the grade 7 girls. Move further along again to the grade 11s, and you see another incredible decrease where we're really looking at only about 10% of the boys in grade 11 meeting that objective. And in the most recent PACES study, only one girl across the province actually met the objective. So we really have our work cut out for us. And if you look at this, it's not a surprise why our adults, more than 50% of women and a little less than that of men, not being physically active enough. So what's the big deal? Well, we know being physically active is related to positive health, but what else? So maybe, is that just a personal choice? Do we really need to worry about it? Well, from a health promotion perspective, yes. From a financial perspective, too, if we think about our healthcare costs, absolutely, because physical inactivity is costing us. And if you look specifically to mortality, there are a number of deaths that are actually related to being physically inactive. 30% of those who die from heart disease, we can attribute that to inactivity. 22% of osteoporosis, so looking at morbidity. 16% of stroke, hypertension, type 2 diabetes, colon cancer. 9% of breast cancer. So there's a major role that physical inactivity plays. And the financial costs, if you look at these, and you know these, of course, will change every year. I believe these are based on 2001 dollars. 354 million annually. It's likely increased if you think over time. So the costs are dramatic. HRM's costs are specifically down there as well. So what can be done? Well, lots can be done. There's lots of different ways we need to focus on it. If you recall from the beginning, I'd said the most effective methods are multidimensional. They involve multiple influences, and in this way, if you look at this, is actually a great figure here. It shows you where those multiple levels can work at. So we can certainly work at the individual level, which is what you will do with your counseling. So increase the knowledge of your patients for why they need to be physically active, the risks of being inactive. Perhaps work on improving their attitudes towards physical activity. Reality is, a lot of people have had poor experiences, or maybe they don't feel they have the skills, or, physical activity has often been seen as frivolous, not as essential. So we need to work on building that attitude that it's necessary. Interpersonally, you need to work family, friends, and social networks. Reality is, we're social people. We don't live our lives independently of everyone else. So our physical activity promotion efforts need to consider that we are part of a family, part of our social networks. Maybe we need to be promoting physical activities that are for families, that do involve our coworkers or our friends. Organizational level, so that would involve things like schools, even workplace wellness. We do need to ensure that our workplaces promote physical activity. Having showers, if a person wants to go for a brisk walk at lunchtime, it's nice, particularly if you're a good sweater, to be able to have a shower just to rinse off a little bit. Maybe we need to have hour-and-a-half lunch breaks so that, we can take some time to be physically active, to wash up if we need, and then have some time to eat. So promoting that sort of flexibleness. And I'm certainly not saying we need to shorten our workday, but just to be flexible for that when possible. In terms of our community, thinking about recreation facilities, recreational programmers, we also need to work with those individuals. And then you get to, and I'm not want to say that this is a higher up level, though that's the way, it almost seems to be. We need to think about public policy. So policies and if you want to look at curriculum here, that our curriculum now has that